There she is. It's Aliya.
Welcome back to Kale and Krunches. I don't even remember how I start my videos anymore. I have no brain. But this is Dr. Aliya, my incredible chiropractor, and you might remember her from videos such as Weird Pregnancy Symptoms #1.
Yep.
Weird Pregnancy Symptoms number 2. And this is Weird Pregnancy Symptoms #3.
Yeah.
Okay, so we're in 3rd trimester, and we're going to share with you, because I've learned so much in this pregnancy, weird symptoms, and I don't want you to feel like you're alone, because you're not, and we're just going to share the ones that you probably are experiencing, but maybe not talking about.
We're putting it all out there, and we'll put it down, you guys can pick it up, and let's start with
we should say, so my chiropractor, but also pre- and postnatal specialist, and mother of 2. Not just like a random person who's an expert in pregnancy.
We just found each other on the road. We were at a Starbucks.
I was like, you look like you had kids once upon a time. Okay, #1. So my weird 3rd trimester pregnancy symptom #1, I would say, is a lack of visual spatial awareness. So what that means is that when you are just going about your day-to-day life and your general movements, there's a pattern to those movements that you don't even understand that you have. So you open up your car door the same way every day. You open up your bedroom door, bathroom door the same way every day, to the same amount of space that you're used to for your body. But now I have this giant bump, and your muscle memory doesn't change or realize that, and I only open up the door the same way I used to, and I can't fit through, and I'm bumping into it. Or I'm walking through a restaurant assuming I can fit in between 2 people's chairs, and then knocking over their water glasses. This happens because you just think that you look the same, and it's just what you're used to. So I am bumping into things all the time, knocking over things, poking my belly with sharp corners, and
yeah,
real.
And it's so real. I remember also parking my car between 2 cars, and then not being able to fit my belly out when I was pregnant.
Right. Because you forget.
You forget because it's what you said. It's muscle memory. It's spatial. You're orienting yourself because the belly is a thing. It's growing. The baby's growing. But for you, you don't feel really, you feel different, but spatially you don't feel really any different. And there's really nothing I can suggest to help you. Just, you know what?
Have awareness.
Have awareness, and maybe put some cushioning around that belly so you don't get knocked around. But no, the baby's in there. It's not being hurt if you bump into things. It's quite, it takes a lot for that baby to get injured. So don't get worried, when you bump into things or somebody catches the side. Yeah. All right. Your next one.
My next one was kind of similar, but an overall klutziness in butterfingers. So I'm dropping things all the time. I'm a pretty big spaz to begin with, but I'm tripping every 5 seconds. I'm holding my phone and then just dropping it. I'm dropping my forks and knives. I fell down the stairs the other day, but we're okay.
We're okay.
But yeah, I'm just a klutz.
Yeah, okay. That's really common too. Klutziness, even some women drive into things.
Really?
Well, I did. But so there's a lot of things at play with this whole thing. So the tripping and the klutziness, over and above your regular amount of tripping and klutziness, because some people are just super klutzy, there's a few things. One is your center of gravity is super off, right? Because your belly is growing. So your center of gravity, which was kind of closer to your spine, now is out here, and so it makes it a little bit weird to move around. Combine that with your spatial awareness or your lack thereof because you have a belly, and that makes you feel like you're going all over the place. The other thing that people don't realize is you're fatigued. You're freaking tired. How tired are you?
Yeah, I'm tired.
Yeah, you are, because you're not sleeping. You're not, if you've been following her, she has some ups and downs in terms of sleep. So you're fatigued, and so you're not really paying attention to what's going on because you're freaking tired. So those things, and then hormones. Hormones are just clouding things. They're making you feel really 1 minute you're flying, and the next minute you're this fucking sucks. So that up and down is also related. And then you were saying your butterfingers?
Mm-hmm.
Okay, so the butterfingers are swelling. They really are.
Really?
Yeah. So you're getting swollen, and you just can't grasp onto things as easily. Things are like falling from you because you're just so swollen, and so that feeling isn't there necessarily. So number 3, swollen vag, swollen vagina. Let's face it, you're not really looking down there. Like, are you looking at your vagina?
I haven't seen my vagina in, I couldn't even tell you how long. I can't skip.
Your vagina gets so swollen, and what it feels like is that sometimes it feels like the baby is like literally right between your legs. Right between your legs. Do you feel like the baby? Not yet, maybe for you.
I don't feel that yet, but I haven't seen it. So she could be swollen.
Yeah, so
I wouldn't know.
So, and the swelling is, bear with me here. I'm gonna say a word, and we all know what the word is.
Fluids.
So basically there's so much blood flow in your body, particularly in your uterus and your cervix and your vagina. What also happens is because the baby's head puts pressure on your cervix, that's what causes your vagina to swell up and your cervix to soften. So
It's like so gross.
it's because the baby's now like kind of shifting into position. So like the baby before was just like, woo, floating, and now it's like, it's starting to kind of get and nuzzle its way into your cervix or onto your cervix and into your pelvic inlet, like deep down into your pelvis. So
I like
sometimes
that
feels like that. If you're feeling swollen in your vagina, but it's also accompanied with pain and like a really weird discharge or anything else that might feel really, really uncomfortable, always have like a healthcare professional, your midwife, your OB, or your family doctor check it out, because it's always better to err on the side of caution in terms of what's happening down in this
And to air it out.
and to air, just air, just open. Step 4 is
Random rock hard abs.
yeah.
Wouldn't that be nice, just in life, to randomly have rock hard abs?
Just to be like walking down the street and one day be like, ooh, my 6-pack. And then like the next second it's gone.
Yeah. Those are Braxton Hicks, right?
Yeah, so
Kind of.
yes, exactly. So when you're
throwing
feeling,
out buzzwords. Braxton Hicks.
I mean, Marley's
I got this.
Marley's the expert in pregnancy now. Okay, so the random rock hard abs are because of what Marley said about the Braxton Hicks. So basically the contractions are about, they could be like between 30 and 90 seconds. And it's a tightening, and it's your uterus like basically tightening, and it's almost like practice. It's like your body's like, ooh, let me just practice for the big event, right? So it contract, and then they let go, and in the meantime your belly gets really, really, really hard, and then it lets it go.
It's so hard, it's crazy.
Yeah.
But I heard from my labor class that when you're actually having a real contraction, it's just like period pain and back pain, and not the rock hard abs.
Correct.
Okay.
So Braxton Hicks is the whole like uterus contraction, so you feel the whole belly get really contract, and actual real labor is kind of deep down, kind of like your menstrual cycle, deep down kind of pelvic pain, and you're right, and it'll feel like back pain as well. So the 5th pregnancy symptom or weird pregnancy symptom is swinging between being super, super like hungry, like hangry, to being like full, like basically in a second. So it's basically one of those things where like you need a Snickers bar, you kind of need to be fed, and everybody's gonna be fine. Otherwise you might put someone's basically eye out, and then in a second like you take a bite and then you're like, what, that wasn't really satisfying, like I wish I could just have more.
Yeah.
But you're like hangry.
You're hangry, and then you get full in 2 seconds, and the fullness is the most uncomfortable feeling ever. It's like it's coming up and it's sitting here, and it's just not going down.
Right.
And I think that my biggest thing is like I went for this amazing pasta the other night with vodka rosé sauce.
Oh my god.
Oh my god, so good.
Mm-hmm.
And the portion was massive, and I could have easily eaten it, but I had to stop myself and like give it to DC and just be like, you have to take this away from me, because I could finish it. I'm hungry enough to finish it, but I know I will feel so uncomfortable, so I could only have a quarter of it and then take it home.
Yeah, so that is really, really common later on in pregnancy. And it's like, didn't you feel completely unsatisfied by that though?
Yeah, I was like, this sucks, because this is like, I could easily eat this, but I just know that there's no room for it. Like I will feel full in 5 seconds.
Right.
And then hungry in 5 seconds.
Because some people's babies sit a little bit higher up, and so their stomachs get a little bit more compressed. And some people's babies hang out down kind of low in their pelvis, and they have no issue kind of in their stomach.
I haven't had an issue because I feel like I have a really long torso and I'm carrying really low.
Right.
And I feel like when she drops, I'm gonna be like, she's gonna be like dragging, sweeping the floors. She's gonna be the sweep. What are the sweepers in Mary Poppins called?
Oh, yeah. What are they? What are they?
Chimney sweeps.
Chimney sweeps.
My belly's
That's
gonna be like
yeah.
chim chim.
You can
chim.
And also remember, like as you get later on in your pregnancy, in your third trimester, you're gonna get really hungry. That's just hormonally. You're getting really. It's like your body preparing. It needs to nourish itself. It needs to nourish, and the baby grows so much in that last final weeks that your body just needs more and more. So it's kind of nice to just, I would say, just have smaller meals. Like spread them out, and even like nuts is like a meal where it doesn't feel like it's so much. And then keep your bigger, heavier meals towards the midday rather than like
so
late.
true.
Yeah, because then you don't want to go to sleep with that. And,
so true.
And then all that kind of heartburn sets in. Okay.
Number 6, bonus, shallow breath. Yeah, so I feel like when I'm talking or out loud, I can't catch my breath and I just get out of breath really easily. It's really what it is. I just have like a really shallow, I can't take good, nourishing, deep, satisfying breaths.
Right.
It's like,
yeah. So you're sitting, and that one's a really common one, sometimes throughout pregnancy, but one of the things that is happening is the baby is sitting kind of up a little bit higher and it's compressing your diaphragm. So your diaphragm's getting really compressed and you're not able to take those deep breaths. And so, one of the things you can do for that, those shallow breaths, are really try to expand from your belly as much as you can and focus on your yoga breathing.
running from my nose.
Excuse me a moment while Marley cleans her nose.
This is in video too.
Yeah. So that's the shallow breath is really common, and you can just kind of really kind of open up, and yoga breathing helps as well. Do you find?
Yeah, I'm doing a lot of belly breathing and I find it helps, but if I'm not consciously thinking about breathing in my belly, I get super shallow breath and it kind of makes me anxious a little.
Right.
It's like, you're not satisfied.
Right. Yeah, so we'll see you guys on the other side.
See you on the other side of motherhood.
Yeah. Thanks for watching.
Thanks for being here, Dr. Aliya.